hello and welcome to our webinar. Thank you for joining today. So today's session will be unlocking the power of knowledge graph-driven AI solutions for pharma research with Peter Dorr from metaphactory.
Thank you and welcome those who have already participated. Today we have a topic that is attracting recently a lot of attention. One topic is AI, definitely an interesting thing, and the second one, more special, is knowledge graphs. And today we talk about how the two things come together in order to support pharma research. And don't worry, that's the first thing I would like to send ahead of my presentation. It won't be very technical. We'll mainly focus on what is the value that we can create with the help of these technologies for pharma research. And therefore, I'm going to start also with the first question, or the grand challenge, that the problem that we want to address with the help of these two technologies. We have a situation where there are many systems and databases out there, and most of you who are in pharma research or in biology, you're using every day tools like the ones that you see on the left, and maybe there are many more that you're using. But we all know that a lot of information that you find in these databases is originally published somewhere in a scientific publication and then found its way into those databases where you can more conveniently get access to it. But we also know that there is a gap between these two systems, if you want. The scientific literature, which is text, and the structured databases that give us, let's say, a simplified but maybe not fully comprehensive view of what has been published. And this is the knowledge gap that I would like to talk about today, and how we can use AI and knowledge graphs to close this gap to a certain good extent. Before I do this, for those who are new to digital science and metafacts, my company, you see it's a combination of both. Some background on us. We belong to the same family where digital science is, let's say, a subsidiary in this group, which has the idea to come up with new innovative technologies that we bring to the scientific community. In 2023, metaphactory, the company that I belong to, was acquired by Digital Science, and together since then we have created a product which is called the Dimensions Knowledge Graph. And this is the tool that I'm going to use in order to show how we are addressing the challenge I mentioned at the beginning, where we have structured databases and we have literature, and what's the gap in between? That's the question. But before we get to that, where does this gap come from? Basically, for main reasons I have listed here. The first one is timing. That means until new information that has been published finds its way into a database can take time. Sometimes manual processing is in place, quality check is in place, and so on and so forth. Secondly, coverage. We see that not all systems can or have the ability to screen really everything that has been published. And oh, you're not seeing my slides? I just got a message. Oh yes, I have to start my presentation. Okay, let me excuse myself. Can you see it now? Probably yes. I will switch off my camera so that you have the full screen available. This is our grand challenge. The systems, the structured databases, and the text, and the gaps that we want to address. I already mentioned timing and coverage, but there are two more that I would like to mention. One is specificity. For those who are working with databases such as StringDB or OpenTargets, in some cases you just have a score that says how strong is the relationship between two entities, how likely is that this protein can be a drug target, or this gene can be a drug target. And last but not least, we also have a bias and a precision issue, because if people are reading, same as machines, text, then the interpretation can be different. Also, this can be a reason why we have such a gap. And now we come to the questions, what can we do? Or what have we done in order to address this? And the first thing that we have to look at is, on the left-hand side, we need to get all the information from these different databases into one. And this task is where a knowledge graph can be very helpful, because knowledge graphs are designed to integrate data from all kinds of, let's say, sources into one simplified format. And here we have created, we think, probably the largest, at least this is what we strive for, the largest knowledge graph that consists out of metadata from all publications, patents, grants, clinical trials that we find in our product dimensions from digital science. All this metadata was used to create information about researchers and research organizations, but for the biological use cases, more interesting is even the semantic annotations. Here we have from dimensions publications, which is not limited to open access, 38 million unique biological and pharmacological causal relationships, and 300 billion semantic annotations from all these text documents. In addition, vocabularies are important, and there's also a lot of those integrated in the system. And last but not least, so far we have more than 20 public databases integrated, such as the ones that I already mentioned, which are great tools. There are many more. I cannot list all of them here. This slide would be too crowded. In total, we have a 33 billion statement knowledge graph that should basically cover the world's scientific knowledge as it is in structured data in one place. And more is possible. So for those who are working with internal data that you create in your laboratories, for example, this is designed to integrate also internally. So that means we have done the work on the left-hand side, and here you see an overview of such databases that we have integrated, and also such kind of ontologies and vocabularies. Probably some of you know them all, some of you only know some of them, but it's possible to connect them all into one graph. And this is the basic, let's say, asset that we have here on the left-hand side. On the right-hand side, it's about scientific publications, and those of you who are familiar with digital science and with dimensions, they know that we have really a very cool literature search tool, which is called Dimensions. Here a screenshot. I will give you also some examples how to use it in a minute. It is a more traditional type of search tool where we can use keywords to search an enormous amount of documents at once and do some analytics at hand. But it's also, let's say, not fully prepared to support deep analysis of, for example, biological relationships and biological processes. Therefore, we have created this dimensions knowledge graph, but this is a very strong asset because it provides us with full text search capabilities. Here you can see an overview, and those who are users of dimensions know this. We have really full text search capabilities with the major largest publishers in the world. In addition, we have preprints and open access and journal and books in, let's say, the scientific data coverage, which gives us a very broad access to the information that we can use to search the full text. It doesn't mean that our customers can get this text from us. This is still the ownership of the publishers, but we can help to find those documents that contain the information that you are looking for. And this is what it's basically about. We want to find those publications that contain information that did not yet find its way into the database that you're using every day. But how to do that? And here won't be a big surprise, AI comes into play. But first, let's talk about the problem that we want to solve with the help of AI. This is the big challenge. It is the text that scientists typically write and the expert language that they use. This is an relatively easy sentence, but you can see it contains a lot of information. And this is why it is so difficult. Imagine how many million documents we have in the database. It is really very difficult to find the nugget that you are looking for if it's a very specialized and precise information that you need. So how do we do this? And this is a little bit technology for those who have more, let's say, interest in the technology behind. We start with a database, and this is a pre-processing basis, where we do in 3 steps the following. We first use classical ontologies in order to identify proteins, diseases, and substances, because this is something where the natural language models are not so good at. Then we use large language models to identify the relationship between these entities. And then we feed the results into our knowledge graph, where we can connect it with all the other data that we already have there. Basically, that's the approach. A little bit abstract and technical. How does it look like in practice? So we go back to the sentence that we just had. And what we do is we convert this sentence into 5 relationships with the help of the process that I mentioned earlier. With the help of AI, we find subject, predicate, objects. Subject is the cause, and the object is the effect. So this is a causal relationship. We see here on the left-hand side the protein, on the right-hand side another protein, and in between we have mapped it to a relationship, in this case decrease expression of 4 times, 1 time decrease secretion of. That means these kind of triples we can then use to feed the knowledge graph. And every information that is in the text is converted into such kind of simple 3 entity triples. And that's basically how a knowledge graph works. And the relationships that we have taught the system to be able to distinguish. I say distinguish and not understand, because the language model doesn't really understand anything, but it can distinguish different relationships, and we have taught it with the help also of specialists and experts who have created training data sets, so that the system can distinguish more than 200 relationships between the entities, genes and proteins, diseases and substances, and also including protein-protein interactions. I will give you now an overview which type of relationships we have, and then we start with a demo, how this can be used. The causal relationships that we have taught the system goes along in total 11 biological processes that we have then, let's say, categorized into 6 different relationship types. Direct relation means, for example, protein A binds to protein B, or activity is increased. A increases, activity of B decreases B. Modulates when it's not so clear what it does from the text. And these green type of relationships, these are the more bold statements by the author, where the author said, oh, A is doing this to B. But then we have also the yellow ones, where the author says something like, potentially it does something, A does something to B, or there's such a complex sentence where it's really hard to say how are the things related to each other. Then we have also this relates to as a type of relationships. This is important because we would like to distinguish between the clear statements and the more blurry ones. So beside this, we have more relationships. This is available for protein-protein and substance-protein. But then we have, in addition, here those relationships that are important for drug target discovery, protein disease. You see the ones that are relevant here. We will do some experiments with it later. For biomarker discovery, we also have a set of in total 13 different ones. We have substance disease, substance, and also protein substance relationships available in the system, and how we use it, I would now like to go. For this purpose, I will switch and go to our search engine dimensions that some of you may know. There's also a free version that everybody can get access to. It's limited in functionality, but also I can recommend to try it out. And we would start with a simple search just to show you where the problem also is that we want to address. And I'm searching here in title and abstract for a name of a disease, glaucoma. And what we find is a relatively high number of 100,000, nearly 120,000 documents. This is already a lot, but if I'm searching in the full text, that means also the body of the publications, we find not 120,000, but we find 500,000. So this is amazing that we have such a large coverage, but on the other hand, what do we do with 500,000 documents? And this is where we need a high precision search that goes far beyond what such a full text search alone can do. And now we're starting the user interface that gives us access to the dimensions knowledge graph, another system with a completely different approach where we have the data organized in a way like the triples I've shown you earlier. And I'm starting within this knowledge graph one special view, which is the relationship search. This is a very simple thing, as you can see. And you can see here subject, predicate, object again. And it's as easy as that. We can start and work with it. And we go with our disease. But not everything. We just want to have glaucoma. What we can see here is an ontology in the back that is proposing terms. We can choose one that is matching best. We want to have the broad concept of glaucoma. What I can do now is I can start searching, but I would like, well, maybe we do a full search. This is really a complex search that may take you time. It comes up with all entities from the classes substances, diseases, and other proteins that are somehow associated with this glaucoma. And this is, you see here, this decreases, relates to the things that I've shown earlier, but we can go to the very end. It's 450 pages. So earlier we had 9,000 entries. So this is still maybe a little bit too much for us to deal with, and therefore we have some easy functionality that you can use. We group by entity one, and then we can see that we have it all organized in a way that we have here first the entity, and then we see the different relationships types. That means this here is a drug. We can see what is reported in literature. What does it do to glaucoma? And decreases, that means treats. That's something we would assume. There are also others like prevents, modulates, and even we see here is also one document where we see the opposite. This is probably a mistake of the system. Also, a language model is not perfect, but we can see here 348 documents are listed, which are the source of information in this case for the insight that the drug latanoprost is decreasing glaucoma. And this is the sentence, so here we see the list of documents. And this is the sentence in this case that was identified, and the reason why this document here is annotated as contains the relationship latanoprost decreases glaucoma. And if we read this sentence, we will see that The second part of the sentence is the reason why this has been selected. That improves the commonly prescribed glaucoma treatment. The interesting thing is that you can see here that the language model understands that this sentence means A decreases B. It translated into a normalized way how we can then consume the data. This is something that we were not able to do before we had large language models. With a traditional literature search, it's really, really hard to get these kind of formulations in the text. This is a simple one. You will see later that there are more complicated ones that are also identified correctly by the language model. And by the way, these 348 entries are ranked by citations. We can then work with it. We can filter. We can search the title. We can limit the publication year. We can only look at, let's say, a high count of citations in order to have the most valuable, potentially valuable documents first. And so with this tool, we have now an ability to identify literature. And remember, we are starting with 500,000. We're now getting very close to very interesting information, and there's much more that we can discover. Let's start a new search, and maybe we take this corticus steroids as the starting point. And we clear the one that we have here, and we start with steroids. And we are now not only looking at glaucoma, but we may be interested in any disease that have, let's say, a connection to this substance. And the fact that it takes a little bit longer tells us that there's a lot. What we see here is for the first relationship, we already find 4,100 documents. And this is giving us, let's say, another important approach to the data sets. We can, for example, now look into a grouping by relation and say, what does corticosteroids do to any diseases? We see it inhibits, decreases a list of 3,500 different diseases that I can open up here and have then further analysis. And so it prevents a lot. So this shows how you can identify even much, let's say, more interesting things, like potentially relates to prevention. This is a source of information that is really going very deep, and it's very well organized and prepared for advanced and precise searches. We're looking at the next thing, and let's clear this here. And we may have a look at another search where we look for, we start with a protein. And we start with cytokines. And we'd like to find out how are cytokines related to other proteins. And see what is the information that we're getting there. Again, it takes a little bit longer because this is obviously a type of protein where we have a lot of research available. And therefore, it takes a little bit longer to get to the result list. And again, we do this relationship. We find, okay, here, this is also an enormous amount of documents that are reporting that there is an increase resulting out of cytokines of other proteins and genes. But we also can see, and this is what I would like to show you here, that we can go into more advanced situations like secretion, and the process of secretion is one that is also interesting. And let's have a this is. This is an arbitrary example that I've just chosen. And if we look at this sentence, cytokines induce the synthesis and release of brain cytokines. This means the release of brain cytokines. This has been interpreted by the language model as this is secretion. So it's a description of the process which has been matched into the correct relationship, as we can see it here. So this is basically what I wanted to show you here, but maybe we go one step further and look into one of the documents that we see here, because the next step, if you're interested in that one, is you would like to know more. And therefore, we have connected this solution that we see here to another product from our portfolio, the digital science portfolio, which is Recube. Some of you might have heard of it. It's a reader and an administration tool for your references, but it has also a nice feature, which is the AI assistant. And this is then the next step, because if you open this, the work starts. You have to read the paper and find out the information that you're interested in. So what can we do? We can now start this AI assistant and ask, for example, what is the role of EL6 in this paper? I hope that this is really a good question. What the AI is now doing, there's a typo. It's basically reading for us this paper, coming back with answers. And the good thing is that it has also links to those sections in the text where this answers has been derived from. So this, in terms of efficiency, gives us also, let's say, a next step of increased efficiency, because with such a tool, we can not avoid at the end to basically have a look at the original text, but it helps us a lot to read faster. And this is in terms of a situation where we are in, we have 20,000 new documents in the database every day. Nobody can really read this. And even if you come up with a precise search, still reading is necessary and can be accelerated, as we can see here. One thing I would like to do is to show you also the case of biomarker discovery. We again go with our disease. In this case, we say it's glaucoma again. Glaucoma on the left-hand side, we have any protein or gene. We start the search. And this is really, now we sort by relation, and we just look at a potential biomarker. And then we get a list of those proteins that have been mentioned as a potential biomarker. With one click, we find the documents. This is convenient, I would say. So we go back to the presentation for just one slide. Because you remember in the beginning, the idea was to say, where's the gap between, for example, open targets and what we find here in literature. And for this purpose, we have another demo prepared here that shows how this can be done. And I'm again going with glaucoma. And this is a drug target discovery tool. That means it comes up with, works just with those relationships that are important for drug target discovery. And we have combined this information from our tool, and let's choose again as a potential target, for example. And then you can see it's combined with the information of the open target's overall score. In some cases, you see that very low scores can be found in open targets, but still we have some evidences that can help to enrich open targets. In some cases, it is even the case that we have things in our database where it's not listed in open targets at all. So, and with this, I'm coming to the end and would like to make a summary. The first thing that we did is we identified the need to build a massive database with basically everything that in science plays a role, in pharma science in this case. Secondly, we have identified, let's say, dimensions as a good tool to give us full text search capabilities, and we used AI to connect things and make a gap analysis possible between, for example, open targets and the literature. This is what you have seen today, a preview of this new dimensions knowledge graph. We are happy for those who are excited about it, and I would like to invite you to become a beta tester of the system. It's available for free testing for 2 weeks. We are happy to receive also your feedback in return, and so I hope that I could encourage you to make the step and try it out. And with this, I'm at the end of my presentation. I hope you enjoyed it, and we have some time for questions. So, Zoe, are you there?
Yes, I'm here. Hi. So at the minute, it doesn't look like we've got any questions. So just to bring everybody's attention to the GoToWebinar control panel, if you do have any questions, just drop them in there. If not, or if you think of any later, you can see Peter's email there on the screen. So I'm sure he'll be happy to field any questions if you have any that you want to send to him privately. We'll wait a couple more minutes to see if any questions pop through. But after a couple of minutes, then we can just let you go on your merry way. Not a question, but Simon says thank you. Thank you for attending, Simon. We hope you enjoyed the session today.
Okay, that's great. So please reach out to me. Here's my email address. Don't hesitate to send an email. Also, if you have questions, happy to receive your messages. And so if you don't have more questions, I think we can close early and wish you.
Thank you again, Peter, for your expertise, and thanks for everyone for attending. We will now close the session.